Hello, Vinod sir, are you online?
Yes, yes, I'm here.
Yes. So can you try presenting on?
I didn't hear you.
So can you try presenting the PPT one?
Yeah, yeah. Okay, can you see it?
Yes, sir.
Is it changing?
Yes, sir.
Okay.
So we'll begin now. Hello everyone and welcome to today's session. And this is the seventh part of the week-long series of Ergonomics. And these events are brought to you by the Rotary Club of the Caduceus, an organization of youth medical and paramedical students. The Webodontia is a week-long event with educational webinars and fun activities. Before we begin, I'd like to mention that the recorded version of this webinar will be available on our YouTube channel, and the forum for questions will be opened at the end of the webinar. And the feedback form for revealing certificates will also be sent in the chat box on Cisco WebEx as well as YouTube Live. And with that being said, I'd like to introduce today's presenter, Dr. Vinod Jathanna. And he is currently working with the Manipal College of Dental Sciences as an associate professor in conservative dentistry and endodontics. He has a teaching experience of over 10 years and he has various publications in international index journals and presentations in international and national conferences. He also serves as a reviewer for international Scopus indexed journals, and he has been a fitness fanatic all along. And we are related to have you speak for us, sir, about ergonomics and dentistry. Thank you. Over to you, sir.
Thank you. I hope you can hear me.
Yes, sir.
Okay. Now, dental ergonomics, this I feel is a very, very important topic for all dentists to understand and also to practice in dentistry. So, before knowing what is dental ergonomics, we need to know what is exactly ergonomics and how do we adapt it into our daily practice. So what exactly is ergonomics? So many of you may have heard about it, or you may know about it. Some of you, I guess the first years are also here. So for us, whenever we say ergonomics, the first thing that comes to mind is posture, or the way you sit, or the way you are working, where you're bending, and all those things. And I think even in the invite, it was mentioned as posturedontics, which is fair enough because it's a major part of ergonomics, but it's not completely ergonomics. Ergonomics uh, is not just about posture. So ergonomics is a very wide ranging field, and it consists of this human factor as well, the way we work, the way we sit, and all that. But also there is something called machine design and task design. Where the task that we do, anything we are doing, we are preparing a cavity, we are doing a restoration, we are extracting a tooth. These tasks, as well as the machine that we are using, the dental chair, the instruments, and everything, all these have to be adapted according to the humans so that we'll be able to use it easily. That is called as ergonomics. For if I have to give an example, for example, the chair that we sit on, it has to be designed in a way where we are comfortable to sit on it. If it is slanting like that, then we'll have to adjust ourselves and then we have to sit, which is not ergonomic. So it has to um, fit to the humans, the task or the machine. So that is called as ergonomics. In other words, we can say anything that is user friendly, it is ergonomic. So it could be a television, it could be your computer, your laptop, your mobile phone. If it is user friendly, meaning you can use it easily without really stressing too much. So that is said to be the design is ergonomic. Okay, there is something called as physical ergonomics and cognitive ones. I won't be talking too much about cognitive ergonomics. Cognitive ergonomics is uh, another large field in itself. It involves your decision making, the mental stress, and all that. Okay, so I'll be talking more about the physical part of it. So if you want the definition, this is the definition. It's an interdisciplinary field of study that seeks to design tools, equipments, and tasks to optimize human capabilities. Like I said, so any task that the human is going to perform, it has to be optimized. So you design the tools accordingly or the task accordingly. So that is the definition of ergonomics. Okay, now coming to this workplace of ours, many of you may be in the clinics already, the rest of you may be in the pre-clinics. But this is where we are going to, all of us are going to spend most of our time um, during our BDS, or if you are doing your MBS, and after that as well, when you're working. So you're going to spend a lot of time in this area, okay, with your dental chair. This, so to speak, this puts food on your table. So if you open a clinic and you're working from, say, morning 9 o'clock to maybe 5 o'clock or 7 o'clock or 8 o'clock or whatever, so you'll be working a long time in this place. So it's very important for you to be um, to work without any pressure or putting too much stress on your body. So when you work a long hours, I think what is your expectation? Your expectation is to earn money probably, and it's fair enough. You will earn a lot of money as well if you put the long working hours in. But the problem is there is something that you'll get for free along with that, and that is this shoulder pain, back pain, knee joints, everything will start hurting. And that is called as musculoskeletal disorders. So, what is this musculoskeletal disorder? As the name suggests, it is the injury or disorder of the musculoskeletal system. And what is this musculoskeletal system? Briefly, if I have to tell, it involves all of these muscles, bones, tendons, nerves, blood vessels, joints, and everything. So, whatever disorder of these musculoskeletal system is called as musculoskeletal disorders. Okay, so it's relatively common in dentists who work for long hours, but there is a solution to this, and the solution is, you might have guessed it, it is called as ergonomics. Okay, the solution to this musculoskeletal disorder is ergonomics. So the application of ergonomics, we can discuss it in four different sections. The work posture, which is a major part of it, the instruments that we use, the workstation, and work practice. Let me talk about work posture first. So it is very important for us to be sitting properly when we are working because we'll be working for long hours. Maybe we are preparing a class 2 cavity. I'm sorry, I'm talking on more conservative, or maybe scaling or a difficult extraction. So it is very important for us to be sitting properly. If our posture is awkward, then it will lead to a lot of injuries. So this is how we sit. Now you guys are all in BDS, and this is how you work, right? This is how you work. You're sitting straight. The head is not tilted too much, but it happens only when the staff is watching, I guess, or most of the time. Even I have done this. When the staff is not watching, uh, any cavity preparation, even in the maxillary tooth, will be direct vision. The indirect vision and the mouth mirror goes out of the window, right? So this, why do we do that? Because it is initially it seems as though it is more comfortable getting a direct vision of the maxillary tooth and then working. Maybe for the first 2 minutes, but if you start doing this for another 15, 20 minutes, then you will start feeling the pain. That's the reason that I have put this picture. You may or may not be doing it, but I'll explain what is wrong with this and why we shouldn't do that, or why we should avoid that, or why your staff keeps on telling you to use the mouth mirror for indirect vision. So this first picture, you can see this is how a dentist is supposed to be treated. You can see the elbow joint is bent at almost a 90 degrees. The head is slightly tilted forwards. The legs are at an angle to the floor, and the knee is bent. Okay. You can see the patient's head, the position. Now, this is also very important, the position of the patient. Which level is the patient's head? Why is it important? I'll discuss about it later. But see the position, okay? And see the second picture. If the seat is not slanted, that is slightly slanted, not that you are going to slip and fall down, slightly slanted. Why it should not be straight like this? Because it causes some impingement. You can see the red area there in the picture. It might cause some impingement on the legs or your hamstrings. So if you sit in that position for say half an hour, 40 minutes, then it might lead to some injuries. And also the spine, you can see in the third picture down, the spine should not be in a C shape, it should be rather in a S shape. That is its neutral position. Okay, the spine should be in a S shape. Otherwise, there will be a lot of pressure. You can see the red dots there, a lot of pressure on your neck and your lower back. Now, I said neutral position. Now, this is a very, very, very important concept to understand. If you understand neutral position, then it will help you correct your posture by yourself. What exactly is this neutral position? Now, when we talk about neutral position, it has everything to do with the joints. It is the mid-range of the joint. Any joint, it is the mid-range. And at that mid-range, the joint is at its strongest. Okay, let me Yeah, why is that important? Because the stress on the joint is minimized when the name itself suggests it is neutral. Okay, when it's at neutral, that means the stress on the joint is minimized, and the body will function better over a period of time. So, what is this neutral position? You can see in the picture for the wrist. Okay, the full range of motion, the wrist will go up till here and down like that. But the neutral portion is mid-range of that joint. Okay, this. So whenever you hold a weight or something, it's very difficult for you to hold a weight when you're in the extreme position. Okay, it will be much easier for you to hold a weight like this, and that is what it shows. It is 100% full strength in its neutral posture. So whenever you're working, make sure that your wrist is not tilted so much for a long period of time. You might want to twist it a little bit when you're extracting or whatever, but for a longer period of time, it's better if the wrist is in a neutral position. Okay, and the same thing holds true for all the joints. And the often neglected part is the ankle. So when you're sitting and your ankle, either you have kept your ankle at an awkward position and you're sitting for 45 minutes an hour, then you start to feel the pain. Again, it should be flat. Okay, or when you're using your foot control as well for a longer time, you need to give a little bit of break in between to protect your ankles. That is the neutral position. Yeah, this is a very important aspect. Now, those who are in the clinics will know that the staff keep on telling that adjust the height of your chair. You need to adjust the height of your chair. You need to adjust the height of the patient's chair. You need to recline it a little bit. Why is that? Height of the chair, mainly because of the knee joint. Okay, like I said, it should be close to 90 degrees. It should be slightly slanted. In this picture, it is not there. It should be slightly slanted, and the height should be proper. If it is too low, what happens? Your knee joint goes up, and that will be an awkward angle for your knee. And the patient's chair needs to be adjusted near your elbow level. It should be at your elbow level. If it's too high, what will happen? Again, a lot of pressure. You can see this in pink. If you're lifting your arm up and working for a long time, then a lot of pressure on the elbows. Ideal is 90 degrees, but up to 60 to 100 is okay. But ideally, it should be at around 90 degrees. That is the neutral position, and that is there a problem? You guys can hear me?
Yes, sir.
Okay. Okay, so that is the neutral position of the elbow. The next aspect is the position of the head. The head should not be tilted. Okay, the head should not be tilted too far. So, like I said, when you are trying to do a direct vision of the maxillary arch, then your head is tilted, right? I request everyone to just mute their mic. I think someone is speaking. I think Dr. Arijit Saha is speaking. Okay, so minimize tilting your head or your body too much. So there was a study that was done. Why it is important? This study was done, and they say the average human head weighs around 5 kgs. Okay, 5 kilograms. But whenever you tilt your head around 45 degrees, the force increases to around 22 kgs. Okay, even if you are tilting your head by 45 degrees, the force on your head or your neck increases to around 22 kgs. The normal is 5 kgs. So imagine it's like keeping 22 kgs on top of your neck, and this is just for 45 degrees. Uh, Pranjali, can you just please ask him
Yes,
to
sir. Yes,
mute his
sir.
mic?
Yes, sir. I'm constantly muting his mic, but somehow it's turning on. Okay, sir. I'll take care of it.
Okay. Okay. So what happens when we tilt our head to around 45 degrees? There's a lot of pressure on the neck and on the spine. And this is just 45 degrees they are talking about. But when we are trying to look at the maxillary tooth with a direct vision without our mouth mirror, we are not only bending, but we are also twisting our head. So imagine 22 kgs or more when we are tilting more, maybe 60 degrees, more weight on that, and then you're turning your head. Imagine what that does to your neck and your spine. Okay, so that is why it is very important for us to use indirect vision for the maxillary arch. The next one is your shoulder. The shoulder joint, again, we are talking about the neutral position. Now, whenever anyone is sitting or relaxing, you never see them sitting tucked in, right? The arms are never tucked in. So the relaxed position is at a slight degree or slight angulation, around 20 degrees, which is okay. More than that, again, there will be a lot of stress on the shoulders. So make sure that when you're working, there is nothing next to you. You are easily able to move your arms. Okay, you don't want to be tucked in when you're working. That will put a lot of pressure on your shoulders. I came across a very interesting article when I was looking at this ergonomics, and this is a study done by NASA. Now they developed something called as the average neutral body posture by studying the human body measurements. And they came up with these postures, and they say this is the neutral body postures. Okay. Now, when you look at the position that this guy in the picture is sitting, it is more similar to what we as dentists do, right? Forget about all the measurements and everything, but just look at the first picture on top. It's exactly how we sit, or we are supposed to sit. Okay. And This is how we are supposed to sit. Now, I hope everything makes sense when I talk about the neutral position or neutral posture. Okay, when you look at this picture with the head slightly tilted, patient's head at the elbow level, so that the elbow is in the neutral position. Right? Next, there is something called a static postures. So it's obvious from the title itself. Static posture is whenever we are sitting for a long time and we are not moving our muscles, or we are not moving our arms and we are not moving at all. That is called static posture. What happened during this time is if you hold the position for a long time, it will result in fatigue and injury because the blood flow reduces, and along with that, the nutrient and oxygen supply reduces. And that could cause tissue damage. But we have a much more serious problem with that. We are not just sitting without doing any work. That is, we are not moving our arms sometimes, but we are putting a lot of pressure, and that is called as static effort. You can see in the first column when you're resting, when your muscles are resting, the blood needed and the blood flow is reduced, which is all right. During dynamic effort, that is, you're moving your arms and all that, the muscle, what the blood needed and the blood flow is more. Okay, your muscles need a lot of blood during that time when you are moving your arms and putting some effort. That is dynamic effort. But the blood flow is also more, so that is again okay. But when you see the third one, there is a static effort. So when we are continuously working, that is a lot of pressure on the muscles of your arms, your legs, your back, your neck, everything. We are concentrating a lot, but we are in that position for a long time. Maybe when we are cutting a cavity, but the blood flow will be less because we are not moving too much. So that will lead to injury. And the solution for that is take a small break. Okay, take a small break in between and maybe do some stretching. I'll talk about stretching later. The other one is force. Now, this is an obvious thing. Whenever you put a lot of force, maybe you're extracting a third molar. Okay, when you put a lot of force and yeah, or extraction, or when you are using a small instrument and using a lot of force, maybe a hatchet, you are using a hatchet and using a lot of force, that also can lead to a injury because you are doing it for a longer time. Okay, force is one thing. Other one is repetitive movements. Even though the force is small, for example, caries excavation. Okay, the force is very small, but there are a lot of caries in the cavity, and you need to excavate it. You keep on excavating it for 15 minutes, 20 minutes. You keep on excavating, it's not going. You are keeping on excavating. What will happen? Again, it will lead to tissue damage. Okay, repetitive movements for a particular part of your body also is it can lead to some injury as well. So even though the level of force is low and the posture is proper, with the repetitive movements, it can lead to injuries. And that is why, again, rest in between is very important. Take some rest, stretch your muscles. That is important. Lastly, the vibrations. So when you're using a handpiece or a scaler, there's a lot of vibration. So when you're using your micromotor or aeromotor, what happens is there is overstimulation of the muscles because it is vibrating. There is overstimulation, and the muscles get tired. Also, when it is vibrating, you want to hold it stable. So you're going to put some more effort, more force to try and control it. Okay, so you need to squeeze harder on the handpiece rather than your hand instrument. That also can lead to muscle fatigue and later on injury. Coming to instruments, this is the other aspect of that was about the posture and the way you work. And the next aspect is instruments. The instruments that you use have to be comfortable. Okay, when you're holding the instrument, it should be very comfortable in your hands. Okay, so use larger diameter. If it is too small, it is very difficult. Of course, some of the instruments are small and we can't help it, like endodontic files and all that. But as much as possible, use larger diameter instruments, balanced instruments. Now, If you don't know what is balanced instrument means the bringing the cutting edge closer to the handle of the instrument. Okay, you can see all those bends in the instrument. Okay, those bends in the instrument. So there are around two or three bends are given so that the cutting edge, the working portion of the instrument comes closer to the handle. When that comes closer to the handle, the balance is better. So that is called a balanced instrument. If the cutting edge is too far away, it is difficult to balance it. Okay, instrument sharpness as well. If the instrument is very sharp and you are able to cut easily, that will reduce a lot of force that you have to use, and that will also reduce the time to cut your cavity or do your whatever work you are doing. And the handles should be textured so that it does not slip. You can see all those textures in your hand instrument. Okay, and the grip span should be curved. It should not be like a square. Okay, it's very difficult to grip it. Even for your forceps, which is for your extraction as well, it's slightly curved. There's a contour to it so that you can easily grab onto it. Okay, this is also a part of ergonomics, instrument design. And when you're using your hand pieces, again, it should be lightweight and balanced models. Again, those curvatures that I spoke about, the bends I spoke about, and it should have sufficient power so that you cut a cavity easily. You should not be using too much of force to cut the cavity. And some of them come with built-in light sources if you need them. If the dental light you think is not enough, some of them come with these built-in light sources as well. Next, coming to the important aspect of workstation. Now, when you see this picture, immediately you feel good, right? There's a lot of space around for you to move around, and it's not closing in on you. Okay, so there should be a lot of space for you to move and for you to sit properly. Okay, for you and for the patient as well. So when you look at this proper chair, this particular chair, you feel like working. Okay, as opposed to a clinic or a chair that is like this, lot of clutter around. There are two chairs there, and imagine someone is already treating a patient in one of the chair, and you have to crawl into that space. This is not exactly an ergonomic design. Okay, in contrast to this, there should be a lot of space for you to move around. And the dentist chair as well, like I said, the height should you should be able to adjust the height for obvious reasons, for your joints to be in a neutral position. And also backrest is also important, and the padding on that is also important so that you are comfortable when you're sitting. The next aspect is the light illumination in your workstation. Um, Light source should be at a proper distance, and for maxillary and mandibular, there are different positions for that. And again, very, very important to use your mouth mirrors for your light reflection. Another use of the mouth mirror is not just for your vision or for retraction. Uh, the light reflection is also one of the use of your mouth mirror. So please use your mouth mirrors properly. It's a very simple instrument, but it's very, very, very important. And also you can use the fiber optics in practice with the lights. Magnification also helps you in keeping that straighter position. Okay, it could be loops or microscopes. Okay, so you don't have to bend and look at it. It's all magnified, loops and microscopes. And the mobile trolleys. So basically, everything should help you in making the task easier. Okay, it should be small, compact, and it should be easily movable. It should not get stuck when you're trying to get an instrument. You should not get stuck and then getting up from your chair, going and lifting it up and getting. It should be easily movable as well. Next, coming to next aspect is the work practice. That is about our workstation. This is work practice, and under that, the most important one is four-handed dentistry. Now, four-handed dentistry is not rocket science. Four-handed dentistry simply means that you are working with an assistant. Two hands plus two hands, four-handed dentistry. Okay. And that means that the assistant is sitting there throughout the procedure, assisting you. Not that the assistant is in some other room and then suddenly you have to get up and go and get the assistant and then start working for mixing or whatever. Assistant is there to hold, it could be to hold the suction, it could be to mix the cements, pass you the instrument, anything, so that the task becomes easier. There are four zones, very easy to understand. Operator zone, where you are sitting, assistant zone, where the assistant is sitting, the instrument transfer zone, slightly in front of the patient, where the uh, transfer of the instrument happens, and then there is a static zone to the right of the assistant, if the assistant is sitting on the left side for a right-handed dentist. So maybe you can keep all the instruments there, the trolley there as well. So that is a static zone. So these are the four zones in relation to the patient. So we know that if we divide the zones according to a clock, okay. So the 7 o'clock to 12 o'clock, you know your positions, your right rear and rear and all those. So 7 o'clock to 12 o'clock for a right-handed dentist is the operator zone, in the shown there in the pink. And in the blue is the assistant zone, where the assistant sits from 2 o'clock to 4 o'clock for a right-handed dentist. And then the instrument transfer zone from 4 to 7 o'clock. Okay, it happens in front of the patient. Okay, the patient will be saying, if you do it from behind the patient, you don't want to surprise the patient suddenly, and patient will jump and all those things. Okay, and then there is a static zone. So that is 400 dentistry. Other aspect is scheduling the patient. Now, you need to keep some rest breaks between the patient. Suppose you're treating around 5 patients per day. I'm talking about minimum 5 patients per day. You need to have some breaks between the patient. You don't want to be all stressed out, and the first patient is okay, then the next patient comes in and you are already tired. So take some breaks in between and keep enough time for each patient. You don't want to hurry through the procedure. Okay, take your own time, take enough time for each patient, and switch between positions throughout the day. Okay. Now I said rest breaks in between. Now what do? You can go and relax, but another thing what you can do is stretching. Okay. Why do you need to stretch? You need to stretch your muscles so that the muscles become more flexible. There is more blood flowing into the muscle. Okay, so that the muscle is ready for your next patient. Muscles are very important, stretching, and over a period of time, it will also strengthen your muscles. Very important to stretch your wrists, because most of the things we do with our fingers and our wrists. To stretch your wrists, your shoulder and neck. Now, like I said, whenever we bend our head a little bit, the first thing that starts hurting is this area, the neck area, the shoulder and the neck area. Because all throughout the day, even if we are not taking or treating a patient, we are on our mobile phone and our head is always bent, right? So do these stretching exercises for your neck and your shoulders. And this is slightly elaborate one, which you can do at home. Okay, before maybe early morning, if you don't have the habit of going to the gym in the morning, maybe in the at home you can do all these stretches. You know that you have scheduled some, you have some 10 appointments or 5 appointments per day. Do the stretching, get ready for that, and then you can come to the clinics. Lastly, and most importantly, I feel strengthening exercises. I feel every single one of us, let me talk about dentists, need to do some resistance training. That is lifting of weights, girls or boys. Okay, they need to strengthen our muscles. Like I said, uh, it's a very stressful job. It can be if we have a lot of patients, and we need to be strong. Our muscles need to be strong. You might have heard that a lot of athletes, a lot of sports persons, cricketers, footballers, they work out regularly. I feel even the dentists need to do that, okay? Because our work demands that our muscles are really strong. Maybe not in the same intensity as them, but some weightlifting is needed so that our muscles are strong. Okay, so strengthening exercises are very important for dentists. So before I finish, a quick recap. I spoke about how good posture is important, the stretching and exercises to make your muscles stronger, and also magnification and the proper instruments will aid in maintaining a good posture. And all of this will help you reduce your strain on the musculoskeletal system. Okay. Now, the presentation wouldn't be complete in this age in 2020 without this slide, I think. So, even when you're working from home, studying from home, attending webinars or whatever, make sure that your posture is right. Okay. Thank you.
Okay, so thank you so much, sir, for telling us the importance of ergonomics and posture in dentistry. And thank you so much for taking time out on a busy Monday. And I think
Thank
it will be
you.
only fair if here on all of us practice ergonomics in our daily life. And with that,
And
I
also
think
exercise. Exercise is very important.
yes,
Okay. Are there any questions or shall we wind it up?
uh, uh, if any of you people have questions, please put it in the chat box so sir can answer.
No questions?
No, sir, I don't think there are any
Okay.
questions.
Okay. Shall we wind it up then?
Yes, sir. Thank you so much.
Okay. Okay. Thank you. Thank you.